A controversial proposal suggests removing organs from living patients undergoing medical assistance in dying, or Maid, to improve transplant success rates. Currently, organs are retrieved only after death is declared. Dr. Carter Winberg of Harvard Medical School argues that since death is certain, retrieving organs while the patient is still alive could save more lives, but bioethicist Lainey Friedman Ross calls it murder. Canada already performs the most organ donations after euthanasia of any country, with 41 cases in 2021. Critics warn of subtle encouragement for patients to donate, eroding voluntary choice. Calgary Herald reports that a paper in the New England Journal of Medicine proposes retrieving organs from medical assistants in dying patients while they are still alive under sedation. The authors argue that since death is chosen and inevitable, the dead donor rule can be reconsidered. Bioethicist Carrie Bowman says the idea could horrify the public and erode trust. Currently, Canada performs more organ donations after euthanasia than any other country. The procedure would allow hearts to be donated and reduce organ damage. No jurisdiction is currently implementing death by organ donation. Toronto Sun reports that a new study by the New England Journal of Medicine says there is a growing acceptance in harvesting organs from medical euthanasia patients while they are sedated and unconscious, but still alive. The study, titled Contextualizing the Dead Donor Rule in an Era of Voluntary Euthanasia, was written by Drs. Carter Winberg, Ian Ball and Robert D. Trug. They are exploring options, not arguing the rule should be discarded. A paper in the New England Journal of Medicine is reviving the idea of death by organ donation for patients receiving medical assistance in dying. The authors argue that since patients consent to euthanasia, the dead donor rule could be reassessed. Organs removed while still receiving blood would be more viable, potentially saving many lives. Critics warn it risks eroding public trust and may pressure vulnerable patients. National Post reports that a new paper in the New England Journal of Medicine is reviving the idea of death by organ donation, retrieving organs from medical assistants in dying patients while they are sedated but still alive. Current law prohibits it under the long-standing dead donor rule, which holds that people must be dead before organs can be removed. The authors argue that voluntary euthanasia creates a new ethical context, and that death by organ donation might improve the quality of donor organs, potentially saving many lives. However, bioethicist Carrie Bowman of the University of Toronto says the idea sounds ghoulish and risks eroding public trust. The emergency room at Fredericton's Dr. Everett Chalmers Regional Hospital was at 400% capacity on Tuesday night. According to a doctor's social media post, Dr. Yogi Sekhal warned patients to expect significant wait times. Horizon Health Network says that 42% of acute care beds are occupied by patients who have been medically discharged, but are waiting for long-term care beds. Health Minister John Dornan attributed the backlog to summer staff vacations and patients coming to the ER for prescription renewals. Vancouver Magazine reports that hospital food in British Columbia remains a serious problem. Shiva Reddy, a beachy food columnist, describes her mother's experience with meals like processed cheese sandwiches and steamed carrots. Eileen Wong, a physician led with Providence Healthcare, explains the challenges of mass-producing safe, tasty food for vulnerable patients. Restaurateur Anoop Virk of Basmati and Spice says food is not a priority in British Columbia and that a centralized authority is needed. Cece Chan, food service manager at Mount St. Joseph Hospital, struggles with staffing and supply chain limitations. The number of former service members in the U.S. Department of Veterans Affairs system with traumatic brain injuries grew by 26% between 2021 and 2025. New data shows, over 2 decades since the 9/11 attacks, 441,639 veterans screened positive for TB. Meanwhile, Congress appropriated 77% less for Defense Department TB research from fiscal 2024 to fiscal 2026. The Financial Post magazine reports that Dr. Marjorie Dixon, a reproductive endocrinology and infertility specialist, helped develop the Ontario Fertility Program, which provides $70 million Canadian annually for fertility treatments. Dixon founded Anova Fertility, Canada's first next-generation embryology lab. She advocates for accessible care for the LGBTQ+ community and racialized populations. Dixon also partnered with a venture capital fund in 2019 to expand her clinic's reach and influence. Selon le Journal de Montréal, Andrina Martin attendit plus citoyens avant de conter la cause de ses difficultés avoir l'endométriose, cette maladie chronique a été diagnostique hypersdenies différents médicales, elle a suivi de traitements de fertilité. de operations, et avec des moments difficiles émotionnels et finalement, elle eut son premier enfant, en novembre 2018, puis en décembre, et elle était aujourd'hui enceinte de son troisième, elle estime avoir eu de chance dans son parcours médical. Mais regrette il manque de conseils sur l'alimentation. Selon le Journal de Montréal, 4 maladies féminines sont encore trop méconnues: l'endométriose, l'adénose, la congestion pelvienne et le syndrome des ovaires polycysticos. Le Dr Michel Boucal, médecin de famille spécialisé en santé des femmes, explique que les diagnostics sont souvent tardifs faute de recherche et de financement. Le Dr Roland Antaki, gynécologue Wimochem, ajoute que même les notes de cours doivent être corrigées par mieux décrire ces conditions. Ces maladies chroniques peuvent causer de douleurs pelviennes et affecter la fertilité. Les réseaux sociaux jouent un rôle pour partager les expériences et sensibiliser. Selon le Journal de Montréal, une étude de Centre de santé McGill auprès d'une dizaine de patients autochtones et de proxédents recommande une meilleure intégration culturelle dans le système de santé. Les participants suggèrent un mieux exercice d'interprètes. Plus de souplesse pour l'accompagnement par des membres de la communauté, et de la possibilité de recourir à des états de guérisseurs traditionnels. L'étude a été réalisée en collaboration avec une nation crédit dans le nord du Québec. Selon le Journal de Montréal, Marie-André Paquin a perdu son focus dans les après une chirurgie bariatrique. Elle pèse 320 livres à son maximum et est aujourd'hui à son focus dans livres, puis qu'elle maintient depuis septembre. Elle explique que la chirurgie n'a été qu'un autre changement estate venides à transformation identitaire. Elle s'entraîne 4-5 fois par semaine, fait de triathlon et participe à des programmes d'accompagnement pour les patients obèses via le bureau de patient pardonné de l'Université de Montréal. Elle aide aussi via son site transformations. Final. Toronto Sun reports that William Shatner has revealed that he and his daughter, Melanie Shatner-Gretsch, both battled stage 4 cancer over the past few years. The father-daughter duo made the revelation in a cover story with People magazine, saying they are now both cancer-free. Gretsch was diagnosed with breast cancer in 2022. Shatner learned he had stage 4 melanoma that spread to his lungs and brain. They are launching a new weekly podcast series titled No Time But Now.